Hello, this is Eric Friedlander, Secretary of the Cabinet for Health and Family Services. Today I'm going to talk just a little bit about long-term care. In Kentucky, I think we have been aggressive and in many ways fortunate. It's hard to believe with some of the numbers we've seen in long-term care that we might be fortunate, but actually, compared to the rest of the nation, we are. We talk about how congregate settings, long-term care settings, and we've seen it all across the world. Now we see it across the nation, and in Kentucky have been some very, very specific challenges as we try to deal with COVID-19. And it has been a big challenge. We've seen quite a few deaths and a fairly high percentage of deaths in Kentucky in our long-term care facilities. And those are folks we know, right? Those are folks I know. And each one is hard and a tragedy. But we took aggressive steps. We stopped in-person visitation very early. We really cut back on the number of folks who could go into facilities. And let's be honest, that's had some tough impacts as well. People who are used to seeing us, our parents, our grandparents. It's been difficult, and we have had to make sacrifices, personal sacrifices, of not really being able to be with our loved ones as much as we would like. But Kentucky, when you look at how we compare to the rest of the nation, we've done a really good job. As you look at the percentage of facilities that have been surveyed, we're in the top 10. As a matter of fact, we finished. We're at 100% today. And when you look at our cases, when you look at our case rate, we're about half of the national average, the good half of the national average. We have made a difference. We have saved people's lives, and that's very important to know. But it has not come without its challenges. And as we move through COVID, we know that we need to begin to start to relax some of our standards. So today, with some trepidation, I am happy to announce that beginning June 29th, we're going to start to ease some of our restrictions in long-term care. We're going to allow for some partial reopening with social distancing, our adult day healthcare centers, and our day training centers. You'll need to comply with the guidelines that'll be up on our websites. The Inspector General's website will have it, COVID-19 will have it, our Department of Aging and Independent Living will have it. It'll be up on several of our websites for providers that want to see that. But we'll set out guidelines for how and when we expect folks to reopen. And really beginning Monday, we can start. We're also going to ease some activities in long-term care. We're going to allow for the resumption of some limited group activities, a return to some communal dining, easing some of our transportation to appointments, again, with social distancing, with masks, and taking appropriate precautions. We're also going to allow some very, very limited visitation to assisted living and personal care homes. Very limited. One at a time, making sure that we are well before we go into those facilities. And then, on July 15th, we're going to start, again, some very limited visitation in our nursing homes and intermediate care facilities. This is done with concern, but at this point we are balancing needs of individuals, needs of families, needs of folks in these facilities themselves to start to see each other again. Please remember, we need the right social distancing. You need to wear masks. Correctly cover your nose, but we need to start to allow for that. This has been heartbreaking for many of us. It's been hard on a lot of us. It's been hard on our families. But remember, by doing that, we have absolutely saved lives. So Kentucky, thank you. And we'll start to get back to being able to see our loved ones. And I hope that we do that safely, and we do that with the joy that we're going to feel to be able to see each other in person again. So with that, thank you.